Hello, concussion management. You asked for it, you got it. We got a lot of requests asking us to do a concussion a kind of a workshop or a webinar, whatever your presentation, whatever you want to call it. So today our topic is concussion management. We're going to talk about it, few things about concussion, how to take care of it and everything. I am Giri Srinivasan, registered physical therapist at Instep Physical Therapy. I've been practicing for the last 22 years, treated more than 16,000 patients. And we are seeing more and more concussion patients in the last few years because there are more awareness among the citizens of Alberta, I should say, coming in even from young adults to the recreational athletes to the sports people, everyone. Okay, so what you're going to learn from this presentation today? What are the objectives, learning objectives for this? We're going to see that. So as you've seen in the slide here, the objectives today is you will, at the end of the presentation, your awareness about concussion will increase quite a bit. Then you understand the signs and symptoms of it. And also you will understand how to prevent concussion. There's a lot of times we can prevent concussion. We're going to learn how to do that. And also, what are the different screening tools are available right now? We used to depend only on the paper tools and before. Now we have a lot of online tools. We're going to talk about what are the online tools we have it, even for the remote screening as well. Right now I'm treating patients from Bonneville and Cold Lake and stuff like that, young athletes from there, by using our tele-rehabilitation platform and online concussion screening tools. So if you live somewhere other than Edmonton and if you want to take concussion care, you have an option there too. And also we're going to learn about what is the multidisciplinary team approach and treatment options here, which is evidence-based, and how to plan your gradual return to work or return to sport, return to school. Those are the things we're going to discuss about it, which you will be learning at the end of the presentation here. We're going to talk about what is concussion is. Everybody know it's kind of a hit or a blow to the head which shakes your brain a little bit and causes some damage to the brain. It is a mild traumatic brain injury, concussion is. And do not believe that only the head or blow to the head only will cause concussion. Sometimes head, other than the head, your blow to any part of the body, it can be your trunk, it can be your leg, it can be landing hard on your feet, can also cause concussion. Right? Whatever causes the brain to move inside the skull quite violently, that can cause some damage to the brain, and that's a concussion. And concussion by the numbers, and you're seeing the North American numbers there, mostly the statistics from United States here. You see the about almost like 4 million people are every year are getting affected by concussion. In that, 71% of the people are males. Right? So males are more common because of their exposure to sports in this category. And what are the high-risk sports for concussion? Your football is number one, basketball, soccer, bicycling, and also playground activities. All our kids in the summertime, they go to the playground, they always bang their head on some of the equipments or with the other kid or something like that. Playground activities is very common for the young children to have concussion. And contact sports is a big thing. We have so many contact sports here in North America. Causes of concussion. You see here in this graph, the fall constitutes about 44.5% of the cause for concussion. That fall includes people tripping and falling on the ground and stuff like that. And also the senior population fall also comes into that. If you have any disability or you're falling from that or any impairments, and also the seniors, as we age, our balance comes down, we fall because of that, and that also comes under that. And 17% of them are from motor vehicle collisions or bike accidents. Those was happening. And then 22% or 23% people getting stuck by an object, and 11% when stuck by a person. It can be a sport or it can be anything else as well. And 3% about assault, and about 1% we don't know what the reason is. In our clinic, we see patients of all ages. As I said, my youngest patient for concussion is 11 or 12, and then my oldest patient is about 72. So it's quite a wide spectrum of patients we see with concussion. The management changes a little bit differently depends on what age, or what gender, what are your goals, what sport or what work you want to return to, and what are your functional goals. The signs of concussion. We see that slide here, we have divided into different components: the physical component, the mental component, the sleep component, and then emotional and behavioral component, right? And these are the main symptoms you see. Headaches. Headache is the most common symptom for concussion. Then people can get nausea, dizziness, especially dizziness with the head movements, and sensitivity is another very important thing. It can be sensitivity to light or sound. And also mental things. The fogginess is a lot of times you hear that people talking about fogginess, right? They can't think straight, they say, and they slow down and increase fatigue, and also very difficult in concentrating and remembering. And this affects people working and also in the school activities for the kids as well, right? It's very difficult to concentrate. Now most of our kids are doing online learning right now because of the COVID situation. How much is concentration is going on there, right? So that's a very important task here. And sleep patterns. You see two types of people in this. Some reported to us like, they are sleeping less, and some group has reported to us they're sleeping more. You can actually face both problems. It depends on where you're at, right? And also difficulty falling asleep, and also insomnia. It's also a very important thing we see, a signs and symptom of concussion. Emotional and behavioral things. Mood changes, sadness, anger, frustration, nervousness, and irritable. This also can experience. If you or your family members, anybody experiences this kind of behavior after having a hit or blow to the head, don't be surprised. You might be going through some concussion symptoms. We just have to be understanding to that symptoms and seek some help for that. That is the best way to go about these signs and symptoms here. Next, we're going to talk about prevention. What are the things we can do to prevent, right? So having mouth guards and helmets during sports activities will not prevent concussions. There's a lot of evidence that these things will not prevent concussions, but they may decrease the biomechanical forces going into your mouth or the jaw or the head. And wearing helmets can prevent skull fracture, but it may not prevent concussion. So you have to understand that. We still, even for seniors, as we age, our balance goes down. We got to put some effort in retraining those balance systems to prevent falls, so that you can prevent concussion. So those are the things you have to talk to or approach a healthcare practitioner for. Hope everybody is doing okay so far. Now, high school students, this is the most important population we see who has concussion a lot. 15% of the high school students, they reported concussion last year, right? And male students are more common with that, and also people or students who play in the sports teams, they're very more common, right? And so you have to educate the kids or the high school students about how to identify the concussion symptoms and report the concussion symptoms. Sometimes they don't report to the teachers or the parents. They kind of think that if I'm going to report it, I'm not going to be able to play tomorrow. So that will be the main reason. So we should educate them the importance of reporting the concussions and seeing a healthcare provider for the same reason. For screening, next we are jumping into screening. For screening, I'm just going to take a break, have a sip. For screening purposes, we used to use SCAT quite a bit. We are still using SCAT. That's Sports Concussion Assessment Tool. There are different versions of this. Usually we do that. Some of the part the patient has to fill it out. Some the healthcare provider will fill it out to see where they stand in their concussion scoring. Now we are using a lot of online tools as well. We're going to go through that very soon, right? And also, while screening by the coach side or the field side, what are the things you have to do as a coach or a trainer or as a parent? What are the things you have to look for in your kids or in adults when they're playing? So unresponsive, loss of body tone. Sometimes you can have a decreased body tone, and you can also sometimes have increased body tone. Very stiff to move the body tones. Those can happen in very severe concussion cases. Sometimes epileptic seizures can happen. So again, that trauma is quite severe during that things. And very slow to respond, to get up from the floor or get up to the kneeling position. They take prolonged time, Then there is something is not functioning very well to execute that body movements. And unsteady legs, and also very kind of lost look on the face. and very emotional, very argumentative, can be very anger, also can come out. So those are the things you have to look for by the side. And also if the player's performance goes down quite a bit compared to what they usually do, you know there's something not right. So these are the things to look for by the field side, right? So as we talked about different tools available out there, and the WOMS, which is your vestibular oculomotor screening, is devised by the University of Pittsburgh Medical Center. We use that quite a bit. It's about a bunch of tests we use to screen the vestibular system and the ocular system, which is your eye movements and everything, see how they are functioning. And also we do a balance testing, we call the BEST test, and also the impact. That's a online tool we are trained for, and also we are subscribed to that to provide concussion screening. We do baseline screening and also post-injury screening using that impact tool. In all our affiliated clinics, including Instep Physical Therapy, we have impact trained concussion therapists. They're all registered physical therapists, but trained under impact and certified under impact to treat concussion patients, and pediatric patients and also adult patients, both categories, using this tool as well. It's a great tool. We've been having great success because we can measure so many things which we are not able to measure before. We'll talk about it in detail. So what does impact stand for? Impact stands for immediate post-concussion assessment and cognitive testing. That's what impact stands for. So again, sports teams come in to do baseline testing, and we'll keep the files in the clinics, and then when they get injured, the coach or the parent brings the kid or the adults again, then we'll do the post-injury testing, post-injury 1, 2, 3, then we'll compare the scores, how they are improving, then we will plan for the return to sport or return to school or return to work activity based on that. So this is kind of a different things what we check in impact. So you can see in the slide there, we check about verbal memory, visual motor speed, the reaction time, and the impulse control. So many things can be tested with this software. That's why it's not only the physical, it's also cognitive testing. The brain functions we are testing on these things. A sample clinical report, you're going to see how the report will look like. This will be sending to the insurance companies or the doctors or anybody, any healthcare providers in the team. They will be given this report on patients itself. So they can even compare the baseline score with the post-injury 1 and the post-injury 2 scores, how it's improving there. You can see that small thing on the bottom of the chart there. It's called cognitive efficiency index. You don't want that score to be between 0 to 0.20. So that tells your brain function is not really good. So you see here how the scores are improving, how the baseline score was 0.53, and then first assessment after the injury is 0.35, how it has improved after a few weeks, 0.42. We can measure everything. So because what we can't measure, we can't track and we can't improve. That's the whole reason we measure everything, including, this is just one part of it, we do the other outcome measures as well. So if you are playing a sport, and a team sport, individual sport, if it's a contact sports or one of the sports we discussed before, please make sure you have done your pre-season concussion screening or baseline screening with your physiotherapist or your healthcare provider, and make sure the file is kept safe. So if you have a concussion, if you have an injury, you can always go back to refer to the baseline screening to do the post-injury screening. That's very helpful. A lot of the sports teams come here in the weekend, they bring the whole team, and then we do the screening for the whole team. Then they go ahead with that, and we'll keep the file set here. And coaches can bring, or parents can bring the kids, and also adult sports as well, the team can come in. So how it works, basically baseline test we do before your injury or things like that. You measure your healthy brain function and have the documentation for that. The impact concussion tool designed between for the ages of 12 to 59. So if you are in that age group, you can be screened for that, right? And then injury happens, then you come in for the post-injury test, then we can take care of what has to be done during the post-injury testing. So the whole concussion protocol looks like these components: educate and do the baseline training, testing, removal from the sport, sideline assessment if you have to, clinical evaluation with the whole team, academic adjustments if you have to, if you're in school, and plan to return to activity. So there is a lot of myths around concussion. And I just put this slide here. You can spend the time. It's a very busy slide to read. This is from Pittsburgh Medical Center actually, this slide, the copyrighted to them. I am thankful for them to allowing me to share this with you guys. It's a very single piece of information with a lot of myths and things. I'm not going to read everything here. I'm just going to talk about a couple of things here. First thing, main important things, people always think you get a concussion only when you get hit directly to the head. Not true. You can get hit in my hip, and when you look at what happens, if I'm getting hit, what happens to my head goes this way, it can cause a concussion in the brain too. So don't think only a hit or a blow to the head only causes concussion. Just a small example. Another thing is people believe if you have a concussion, you have to shut yourself in a dark room and sit there for a while. No, you don't have to. There is evidence-based treatment approaches to take care of concussion by vestibular therapy, vision therapy, exertion therapy, manual therapy. We're going to talk about this later to get you back on your feet as soon as possible. And also, people think every concussion will cause a lot of brain damage, irreversible brain damage. Not true, right? Most of the things can be worked on unless it's very severe. It's not all changes are irreversible. There's some other things here, right? And then you can read that and you can get more educated about that, right? Interventions, how we approach it, right? And if you have a concussion, what to do about it? Physically, immediately after the concussion, you need to have very strategic rest periods, okay? 15 to 20 minutes throughout the day. Activity pacing and energy conservation is very important in the initial phase or the acute phase after the concussion. You can't just go ahead and do everything what you do normally. That's going to exhaust you quite a bit. That's going to drain you mentally and physically. So strategic rest periods is very important. We advise that for all ages after concussion. And also just some activity modification. Don't get exposed to bright sunlights or loud music, and also taking frequent breaks from what you do and reduce the physical activity. This is where your physiotherapist comes into role to tell you exactly what to do based on your condition, because every concussion patient is different. Every concussion patient's cocktail of symptoms is different. Okay, so that we have to have an individualized treatment plan. That's when your registered physiotherapist is going to help you to assess and treat you based on your symptoms. And also cognitively to reduce the workload, whatever you're doing. Emotionally, and that's when you have to understand, plus your family members, your cohort has to understand how to work with you with all these emotional changes happening to you. Okay, and sleeping will be affected too, so we have to have some plan for that as well. So multidisciplinary treatment approach, it's a team treatment approach for this, right? There's a lot of people come into play. You can see the slide there, and there's a physiological changes happening in your musculoskeletal system, in your nervous system, in other systems in your body as well. There's a vestibular component, which is your inner ear, brain, the balance system there. And there's ocular component, which is your eyeballs and things like that. The cervical component, neck. So even if you just see these components, there's a physiotherapist involved in there, there's a family physician involved, sometimes a neurologist is involved in there, and then there is a chiropractor involved in there sometimes, massage therapist, athletic trainer, the coach, the patient, the parents, the school teachers, everybody is involved in the care. And also the psychologist. Sometimes if we have help with that, some of the cognitive functions, we refer to the neuropsychologist. We have in our team to refer the patients for that help as well. So all these things has to be addressed with this appropriate team. And for vision therapy, we also refer to a couple of optometric clinic here. We do some vision therapy in the clinic as well. Sometimes we refer out for some vision therapy as well to some optometric clinic. So they do the vision therapy as well. So they all have to come in a kind of in a congregation to kind of get you help to recover from concussion. So how would the evidence-based concussion treatment would look like? What are the different types of therapy has to come into play for you to go to play again, right? So multi-system examination, we just described that in the previous slide. What are the different systems, different people come into play? Education, that's very, very, very important. Education is such a powerful tool, and that's the best medicine for you to understand what concussion is and how to get better from there. And we talked about different therapists, vestibular therapists, and most of our concussion therapists are also vestibular therapists. So they can help you with your dizziness, nausea, those symptoms, whether it's coming from the inner ear or coming from the neck or coming from the brain, how to identify that and how to treat that efficiently. Vision therapy to take care of your gaze stability and other issues. Exercise therapy, you can't recover without exercise. It can be strengthening, it can be aerobic exercises, it can be conditioning exercises, it can be any type of exercises, what is needed for your body to return to whatever you want to do. Balance retraining, very important component. Exertion therapy, for some of you it might be a new term. Exertion therapy is an evolving thing, that how to exert your body, how to bring the signs and symptoms, and we're going to discuss about that later, and get you back to where you want to go, take you to the finish line. And also gradual return to sport or work or school, whatever it is. So these are the components of effective concussion treatment. So your therapist is well equipped with manual therapy, exercise therapy, vestibular therapy, vision therapy, concussion therapy, exertion therapy, and also planning. So that's the kind of therapy is going to help you to get back on your feet again very effectively when you have a concussion. Examination. What are the things we do? Just a small information about examination. We take very good history about what happened and what's your past medical history, current medical history, everything, and evaluating your neck. And also we talked about the WOMS, that's your vestibular ocular motor screening. That will be done, and everything in the vision, gaze stability, and also head writing reactions. Complete neurological screening will be done, and also any dizziness is there, where it's coming from, and the balance and your gait, and what is your exertion response. Everything will be assessed, and then your functional goals will be discussed, and then your treatment plan would start. Patient education. We spend a lot of time here explaining what happened to your body, to the patient. That's very important, because once you're educated, once you're empowered with that information, you can take informed decisions about your care. Manual therapy, and almost every physiotherapist in our organizations and affiliated clinics are certified manual therapists. So they will be working on your joints and muscles and fascia to get them back to proper function. Vestibular therapy, as I said, we have certified vestibular therapists, and we also have some advanced tools, infrared goggles and things like that, or frontal goggles, they talk about it, to screen you properly for anything to be helped upon in your inner ear or the brain or the neck, whatever it is, and we will analyze that and we treat according to that. And then while treating the dizzy patient, for the next slide, what are the goals of the vestibular rehabilitation, right? We're just going to make sure your body and brain is able to process the balance information, how to help them, to guide them. It's a busy slide. It's a borrowed slide from a presentation for the thing. So if you see here, you will see canalith repositioning exercises, postural control exercises, fall prevention exercises, strength training, endurance training, everything compromises into the vestibular rehabilitation. And we also treat vestibular patients other than concussion as well. You don't have to have a concussion to have vestibular symptoms. There are a lot of other reasons and causes for vestibular problems as well. And we go through certain techniques. We don't want to go much into details of that. Habituation, adaptation, substitution, and those are the techniques, or those are the things we use to kind of go for that, treatments for that. Vision therapy, we do a lot of things in the Instep clinic as well, and affiliated clinics. We are using different things like Brock string, or we have mandarin balls, all those things. So those are the small tools we use it. Sometimes we will refer out to the optometric clinic as well for vision therapy. Balance training, there are graded balance training. We start from level 1 to level 6. There are different things out there, and we will progress you based on how you're coming along during your balance treatments. And this is just a small slide to tell you why it's so important to train on your balance, how your balance system works. The stimulus goes from your eyes, your vestibular system, even from your neck and your feet to the brain. Brain processes and controls, brings out the commands to your muscles, and the muscle stabilizes and movements, and also the biomechanical patterns. So if anything is not working in this, it will be a problem. Then we have to work on it to fix it. In concussion, one or more of the systems can be affected, which can be worked very efficiently with the management. Some of the main symptoms we see for the post-concussion is right here. People sometimes call it as a post-concussion syndrome as well. And you can have a problem with the cognition, physical, emotions and mood, and sleep disturbances as well. And some of you who had concussion can relate to some of the symptoms you see on the slide here. It's a little busy slide. We talked about exertion therapy. What is exertion therapy? It is it's an individualized program to decrease exercise sensitivity post-concussion. Because post-concussion, a lot of increased sensitivity for a lot of things like light, sound, exercises will be there. We got to manage that and slowly expose you to exertion to return to your functional goal or a sport goal. Okay, that's called exertion therapy. So we progress the exercises based on these parameters, the type, the repetitions, duration, frequency, and intensity, right? So our goal is to kind of treat you until the dizziness symptoms goes away with the activity. So that then we will test you for kind of return to sport, and also there is guidelines for return to sport as well for that. We're going to see in the next slide for that. So I'm thankful for Complete Concussion Management for this slide. It's copyrighted for them. How kind of the different stages here we go through after the concussion, from stage 1 to limited activity to all the way to stage 10 to gameplay. So how we slowly go about each stages with the guidance of your physiotherapist and you and your team. This is the whole picture of that. So there are steps to go about it, right? Everybody wants to jump in and play right away, but it's not the right thing to do. You need clearance for each and every stages, and also to return to sport with the full contact, the full practice. The progression, another small slide about how the return to sport progression should be from the symptom limited activity to all the way to return to sport for the normal gameplay, right? It's very important. Again, this is where comes in your family physician, your physiotherapist, your coach, your trainer, your parents, and you. We have to be on the same page to get you back there. You have to remember the 5 R's of concussion. That's a take-home message from us. Recognize there is concussion, things happened, and then remove the patient or the client or the student from that activity immediately. There is no point in getting him continue to play right away. If you know there's a concussion symptom, then refer for appropriate referrals, family physician and neurologist, physiotherapist, athletic trainer, right, and psychologist, massage therapist, all the whole team, refer to the appropriate people for appropriate help. Recover. That happens in stages in concussion. We just saw those stages there. Then return. Either return to work, sport, regular life, or a play. Whatever you want, whatever your return to places. So, if you have any questions about anything about concussion or what symptoms you're having, you're not managing, please call us to talk to one of the certified concussion therapists and any one of Instep physical therapy or our affiliated clinics around the town to ask about your current condition. If you have any questions, you're not sure about how to go about it, and to get a second opinion. Or if you get stuck in your rehab, some of the symptoms have improved, but some of the symptoms have not improved, how to go about to the next stage. And you can call and discuss about it, or come in for a discovery visit to talk to us about it. Are not recovering well enough, or you have to do a baseline screening for yourself as an individual or for your team. You can talk to us. We can schedule something for you guys to go through the baseline screening, and we'll maintain the file here for you to come back if you have a concussion later in life. Post-injury screening after the concussion, we can take care of that. And tele-rehabilitation options. Right now, I'm treating 5 patients in tele-rehabilitation with concussion from different parts of Alberta. And from young people to middle-aged people as well. So that's an option too. If you don't want to come into the clinic, we can do a lot of this tele-rehabilitation for, I call it comprehensive video consultation to analyze you. And I can send you the screening tools by email. You can fill it and send it back to me. I can analyze the scores. Then we can have consultations like that as well. And there are limitations to tele-rehabilitation as well. We can't do manual therapy and things like that. But something is always better than nothing for no care, right? Our affiliated clinics in and around town, you can see that in the slide. We have a clinic in the north side, close to Londonderry Mall. It's called Family Physiotherapy Clinic. We have a clinic in Rabbit Hill Road in Trevelliger, Momentum Spine and Sport. We have another branch of the clinic in St. Albert as well, inside Kingsridge Medical Clinic. Then we have in Northeast near the Coliseum, we have Eastwood Physiotherapy Clinic. We have Next Step Physio and Concussion Clinic, aptly named for that. That's on White Ave. We do a lot of concussion there as well. Impact Physio and Sport Clinic in Beaumont, and Emerald Hills in Sherwood Park, Granville Physiotherapy in the West Edmonton, and Redwater Physiotherapy, obviously in Redwater. So we have concussion therapists in all these clinics as well. And again, here, this is Instep Physical Therapy as well. Okay, thank you so much for your patience and time. Listen, hopefully this give you a little bit of an idea about concussion, how to take care of it, what are the options available for you and your team to kind of take care of it properly and also return to your activity, whatever that activity may be. And we will take you to the finish line. And signing off, Giri Srinivasan, registered physical therapist, Instep Physical Therapy. See you guys soon in another webinar.